I want to describe something that I think a significant number of people watching this will recognize immediately. It is 10:30 at night, the house is quiet, the day is finished. By any reasonable measure, this is the moment when your mind should be winding down, releasing the concerns of the day, loosening its grip on tomorrow's list, settling into the gentle approach of sleep. But it is not doing that. Instead, your thoughts are moving faster than they were an hour ago. The mental chatter that was manageable during the day, when you were occupied and distracted, has become louder now that there is nothing else competing with it. Worries that felt proportionate in daylight feel larger in the dark. Small concerns circle back. The body is tired, but the mind is activated, running at a speed that has no obvious purpose and no obvious off switch. You are exhausted, and you cannot wind down. This experience, the anxious, overstimulated mind that refuses to quiet at night, is one of the most common complaints I hear from patients over 60. And it sits at the intersection of several things that are genuinely and separately important: sleep quality, anxiety, cognitive health, the neurological changes of aging, and, as I want to explore with you today, nutrition. Because the state of the brain at night, whether it is calm and able to transition into sleep or activated and unable to, is significantly influenced by what you eat, by the specific biochemical environment your brain is operating in when you lie down, and by whether your diet is providing the compounds your nervous system uses to manage arousal, regulate anxiety, and make the neurological transition from wakefulness to rest. Today I want to talk about one fruit, something specific, something affordable, something backed by a growing body of research that addresses the neurobiology of nighttime anxiety and brain calm through multiple distinct mechanisms. And I want to walk you through the science carefully, because I think understanding why something works is what makes you actually use it consistently rather than trying it once and forgetting about it. But first, let me explain what is actually happening in an anxious brain at night. Because the mechanisms matter, and because once you see them clearly, the solution I am going to describe will make immediate sense. Anxiety, at its most fundamental neurological level, is a state of excessive excitatory activity in the brain. The neural circuits associated with threat detection, vigilance, and anticipation are overactive. The inhibitory systems that normally balance them, that provide the neurological counterweight that says, "Enough, the threat is not real, it is safe to stand down," are underperforming. The primary inhibitory neurotransmitter in the brain is GABA, gamma-aminobutyric acid. GABA is the brain's main calming signal. When GABA binds to its receptors on neurons, it reduces the likelihood that those neurons will fire. It quiets neural activity. It dampens the excitatory signals that drive alertness, rumination, and anxiety. In a well-regulated nervous system, GABA activity rises in the evening as part of the transition towards sleep. Excitatory neurotransmitters, glutamate, norepinephrine, acetylcholine, decline. Cortisol, the stress hormone that keeps the brain alert and the body mobilized, falls toward its overnight low. The net effect is a progressive calming of neural activity that allows the mind to release its grip on the day's concerns, stop generating new thoughts, and slide into the restorative unconsciousness of sleep. When this transition fails, when the GABAergic inhibitory system is not providing adequate calming, when cortisol is not declining as it should, when the excitatory systems remain dominant despite the hour, the result is exactly what I described at the beginning: an exhausted body, an activated mind, and the frustrating inability to find the off switch. This failure can have multiple causes. Chronic stress keeps the HPA axis, the hormonal stress response system, in a state of sustained activation, maintaining cortisol at levels that compete with sleep onset. Aging reduces the sensitivity and efficiency of GABA receptors, meaning the brain's inhibitory signals become less effective at quieting excitatory activity. Magnesium deficiency. extraordinarily common in older adults, directly impairs GABA receptor function because magnesium acts as a cofactor for GABA receptor sensitivity. And chronic sleep deprivation itself is anxiogenic. It raises the brain's threat detection sensitivity and reduces the prefrontal regulation of anxious thinking, creating a cycle that feeds itself. Now, there is a second neurotransmitter system that is deeply relevant to nighttime anxiety, and that is less commonly discussed: the serotonin system. Serotonin, most commonly known for its role in mood regulation, also plays a significant and specific role in anxiety. Serotonergic signaling in the amygdala, the brain structure most associated with threat detection and fear responses, provides a regulatory brake on amygdala activation. Adequate serotonin keeps the amygdala from overreacting to stimuli that do not genuinely warrant a strong threat response. Insufficient serotonin leaves the amygdala less regulated, more easily activated, less easily quieted, more prone to treating ambiguous situations as dangerous ones. At night, when the prefrontal cortex, the brain's rational regulatory center, is least active and the amygdala and default mode network are most dominant, serotonin's regulatory function becomes especially important. The anxious thoughts, the circular rumination, the disproportionate worry that characterizes nighttime anxiety are, at the neurochemical level, partially a reflection of inadequate serotonergic regulation of limbic activity. Serotonin is synthesized from a dietary amino acid called tryptophan through a B6-dependent enzymatic process. It cannot be directly supplemented in a form that crosses the blood-brain barrier. The only way to support serotonin levels in the brain is to ensure adequate dietary tryptophan and the nutritional cofactors, particularly B6, magnesium, and zinc, that the synthesis pathway requires. There is a third dimension that is genuinely underappreciated in discussions of anxiety, and that is the gut-brain axis. Approximately 90% of the body's serotonin is produced not in the brain, but in the gut, by specialized enteroendocrine cells and by specific beneficial bacteria in the gut microbiome. While this peripherally produced serotonin does not directly cross into the brain in its serotonin form, it communicates with the brain through the vagus nerve, the primary nerve of the parasympathetic nervous system, and influences central serotonin signaling through a complex bidirectional communication pathway. Research consistently shows that people with disrupted gut microbiomes, less bacterial diversity, higher inflammatory bacterial species, show elevated anxiety symptoms, elevated cortisol, and worse sleep quality compared to people with healthier, more diverse gut microbiomes. This is not simply a correlation. The mechanisms are increasingly well understood. Gut bacteria produce neurotransmitter precursors, short-chain fatty acids that support blood-brain barrier integrity, and signaling molecules that directly influence vagal tone and therefore the brain's arousal state. What you feed your gut microbiome in the hours before sleep influences the vagus nerve signal your brain receives during sleep. A well-nourished microbiome sends calming parasympathetic signals to the brain that support the low arousal state required for deep, anxiety-free sleep. A dysbiotic, poorly fed microbiome sends stress signals that compete with it. Now, with those three systems in mind, the GABA system, the serotonin system, and the gut-brain axis, let me tell you about the fruit. The answer is passion fruit, specifically Passiflora edulis, the purple or yellow passion fruit found in most grocery stores and increasingly in mainstream supermarkets, whose nutritional profile maps with remarkable precision onto the exact neurobiological gaps I have described. Let me walk through the mechanisms one by one, because each one is genuinely distinct, and each one addresses a different part of the anxious nighttime brain. The first mechanism is direct GABAergic activity. Passion fruit, and particularly the seeds and the white pith surrounding the seeds, which most people discard, contains compounds from the flavonoid family, specifically chrysin and passiflorine, that have documented interactions with GABA A receptors. GABA A receptors are the primary target of the benzodiazepine class of sedative and anxiolytic drugs, the same receptors that Valium and Xanax act on. Chrysin and passiflorine interact with these receptors through what is called positive allosteric modulation. They enhance the receptor's sensitivity to GABA without directly activating it the way pharmaceutical benzodiazepines do. The clinical significance of this is meaningful, but needs to be placed in honest context. The effect of dietary chrysin from passion fruit is considerably milder than the effect of pharmaceutical GABA modulators. This is not a drug-equivalent intervention. It is a gentle, food-based support of the same receptor system, amplifying the brain's own GABA signaling rather than overriding it. For someone whose evenings involve a mind that is moderately overstimulated and resistant to quieting, this gentle enhancement of GABAergic tone can make a meaningful and noticeable difference over consistent daily use. A study published in Phytotherapy Research, specifically examining the anxiolytic effects of passiflora extract, found significant reductions in anxiety scores compared to placebo, with a side effect profile that was comparable to placebo, meaning the calming effect was achieved without the sedation, cognitive impairment, or dependency risk associated with pharmaceutical anxiolytics. A Cochrane review on passiflora for anxiety and sleep found the evidence base supportive for short-term anxiety reduction and sleep improvement, while appropriately noting that larger randomized controlled trials are needed for definitive conclusions. The second mechanism is magnesium delivery. Passion fruit is one of the more magnesium-rich fruits commonly available, providing approximately 30 to 35 milligrams of magnesium per 100 grams of pulp. This is not the sole or primary source of magnesium a person needs. Magnesium requirements for adults are in the range of 300 to 400 milligrams per day, but it contributes to the broader daily magnesium intake in a context where many older adults are chronically insufficient. Magnesium's role in anxiety and sleep quality is well established and operates through multiple pathways. As I mentioned, magnesium is required for normal GABA receptor function. It acts as a cofactor that maintains receptor sensitivity. Without adequate magnesium, GABA receptors are less responsive to GABAergic signaling, and the brain's inhibitory capacity is reduced. Magnesium also regulates the activity of NMDA receptors, the primary excitatory glutamate receptors in the brain. It acts as a natural channel blocker, reducing excessive glutamatergic excitation. In magnesium deficiency, NMDA receptors are overactive. The excitatory-inhibitory balance shifts toward excitation, and the neurological signature is anxiety, hypervigilance, and difficulty quieting mental activity at night. Magnesium also directly regulates cortisol production through the HPA axis. Adequate magnesium helps maintain the normal circadian decline in cortisol that is supposed to happen during the evening hours. Magnesium deficiency is associated with elevated nighttime cortisol, one of the most consistent drivers of anxious rumination at bedtime and fragmented sleep through the night. The third mechanism is tryptophan and serotonin support. Passion fruit contains tryptophan, the amino acid precursor to serotonin, alongside vitamin B6, the cofactor required for the enzymatic conversion of tryptophan to serotonin. Eaten in the evening, pre-sleep window, passion fruit provides both the starting material and part of the processing equipment for serotonin synthesis at the time when the brain is most dependent on serotonin for regulating limbic activity and supporting the emotional calm that sleep requires. The fourth mechanism is the prebiotic effect on the gut microbiome. Passion fruit is rich in soluble and insoluble fiber, particularly pectin in the pulp and harder structural fibers in the seeds. This fiber provides substrate for the beneficial bacteria in the gut that produce neurotransmitter precursors, short-chain fatty acids, and vagal signaling molecules. Consistent dietary fiber in the evening supports the gut microbial environment that the gut-brain axis depends on for its calming parasympathetic signaling to the brain. The fifth mechanism And this one is less commonly discussed, but genuinely relevant to anxiety in older adults specifically, is the antioxidant protection of neural tissue. Passion fruit is extraordinarily rich in antioxidant compounds, vitamin C, beta-carotene, and a range of polyphenols including orientin, isoorientin, vitexin, and isovitexin. These polyphenols have documented anti-neuroinflammatory effects. They reduce the microglial activation and neuroinflammatory signaling in the brain that is increasingly recognized as a driver of anxiety, depression, and cognitive decline in aging adults. Neuroinflammation, chronic low-grade inflammatory activity in the brain, is associated with elevated anxiety, reduced GABA receptor sensitivity, disrupted serotonin signaling, and impaired HPA axis regulation. All four of the neurobiological drivers of nighttime anxiety that I described earlier are worsened by neuroinflammation. The antioxidant and anti-neuroinflammatory compounds in passion fruit address this underlying inflammatory dimension of anxiety in a way that most dietary discussions of anxiety and sleep completely overlook. I want to tell you about a patient I will call Philip. Philip was 67. He was a retired architect, methodical, precise, a man who had spent his career solving complex spatial problems. He came to see me not about anxiety in the clinical sense. He did not think of himself as an anxious person. He described himself as a worrier, someone who had always thought ahead, always anticipated problems, always kept several contingencies running in his mind. In his working years, this had served him well. In retirement, without the structure of work to contain it, this same mental pattern had become something that was keeping him awake. He described lying in bed with his mind generating an endless stream of low-level concerns. Nothing catastrophic, nothing that warranted the intensity of attention his brain was giving it at 11:30 at night. His children's finances, the leak in his garage roof, whether his blood pressure medication needed reviewing, whether he had said something unhelpful to his wife that morning. Circular, repetitive, purposeless, but entirely unstoppable until somewhere around 1 or 2 in the morning when exhaustion finally overtook it. He was sleeping approximately 5.5 hours on most nights. He woke tired. By mid-afternoon, he was managing on willpower. He had tried reading before bed, avoiding screens, chamomile tea. None of these had produced a change he could sustain noticing. I suggested passion fruit. 2 fruits, eaten about an hour before bed, including the seeds, not spat out, chewed, for 4 weeks. I also added a magnesium glycinate supplement at 300 milligrams at bedtime because his diet history suggested he was likely well below adequate intake, and the supplement would address the deficiency more reliably than food alone in the short term. By the end of the 2nd week, Philip reported something he framed as a peculiar absence. The thoughts were still there when he lay down, but they seemed to have less grip. They arrived and moved on, rather than circling back repeatedly. He was falling asleep within 20 to 30 minutes, rather than the hour plus he had been accustomed to. At 4 weeks, he said something I found genuinely touching. He said he had forgotten what it felt like to lie in bed without his brain trying to solve something, and now he was remembering. He did not attribute this entirely to the fruit. He acknowledged that the magnesium was likely contributing, and that some of the change might have been the natural variation of a sleep problem over time. He was right to be appropriately cautious, but the improvement was consistent, sustained, and he found it worth maintaining. He continues eating passion fruit most evenings. Now let me be specific about how to use this correctly, because the details matter. 2 whole passion fruits eaten approximately 1 hour before sleep. The pulp, the orange, seedy interior, should be consumed entirely, including the seeds. The seeds contain concentrated quantities of the chrysin and flavonoid compounds responsible for the GABAergic mechanism. Most people instinctively either swallow them whole or chew them briefly. Either is fine, though chewing them improves the release of the active compounds. The white pith on the inside of the purple or yellow skin is often discarded. It should not be. It is one of the richest parts of the fruit for passiflorine and related GABAergic compounds. Scoop it out and eat it alongside the pulp. 1 hour before sleep is the timing that makes biological sense for the mechanisms involved. The tryptophan and B6 need time to enter the bloodstream and be available for serotonin synthesis. The chrysin and passiflorine need time to be absorbed and reach the brain. The magnesium needs time to begin its GABAergic facilitation. An hour provides that window without being so far in advance of sleep that the compounds have begun to metabolize past their peak activity. Do not eat passion fruit alongside dairy. The protein competition for tryptophan transport across the blood-brain barrier that I have described in other contexts applies here equally. Eat it alone or alongside a small handful of walnuts, which have their own modest melatonin content and whose fat content supports the absorption of fat-soluble compounds from the passion fruit. Both purple and yellow varieties are effective. The purple variety tends to have a more concentrated polyphenol profile per gram. The yellow variety tends to be larger and easier to find in mainstream supermarkets in some regions. Either works. What matters is consistency. Daily use over weeks rather than occasional use when you remember. For people who find whole passion fruit difficult to source reliably, passion fruit concentrate or puree, unsweetened, without additives, is a reasonable alternative that preserves most of the relevant compounds. 2 tablespoons of pure passion fruit pulp or concentrate in the evening provides approximately the equivalent dose. Avoid passion fruit juices, which typically remove the seeds, reduce the fiber, and often add sugar. Let me now address something important. Passion fruit provides meaningful but not unlimited support for the neurobiological systems involved in anxiety and sleep. It is not a pharmaceutical anxiolytic. It does not override severe anxiety or clinically significant anxiety disorders. For people experiencing anxiety that is significantly disrupting their daily life, not just the evening rumination most older adults experience, but anxiety that is pervasive, functionally impairing, and affecting relationships and daily activities, a conversation with a doctor or mental health professional is appropriate and may include medication, cognitive behavioral therapy, or other evidence-based interventions. What passion fruit addresses most directly is the kind of anxiety that many older adults experience primarily in the evening, the overstimulated mind that will not quiet, the circular thinking that arrives at bedtime, the cortisol that has not declined as fully as it should by the time they lie down. This is a nutritional and neurochemical problem as much as a psychological one, and nutrition is a legitimate and meaningful part of addressing it. Let me also address the broader context, because passion fruit works best as part of an evening approach that supports the same neurobiological systems from multiple directions. Magnesium is the most important complementary nutrient. If passion fruit is addressing the GABAergic and serotonin dimensions of evening calm, magnesium glycinate at 200 to 300 milligrams at bedtime addresses the same dimensions more directly and reliably. Magnesium glycinate is the form best tolerated and best absorbed at night. It does not have the laxative effect of magnesium oxide and is significantly better absorbed than magnesium citrate at equivalent doses. If you are going to try one nutritional supplement for evening anxiety and sleep quality, magnesium glycinate is the one with the strongest evidence base and the most direct relevance to the mechanisms I have described. L-theanine, an amino acid found almost exclusively in green tea, is a second complementary compound worth mentioning. L-theanine increases GABA activity and reduces the activity of excitatory neurotransmitters, producing a state of calm alertness that many people describe as feeling like the mental noise has been turned down without feeling sedated. At 100 to 200 milligrams in the evening, it complements the GABAergic activity of passion fruit's chrysin and passiflorine through a related but distinct mechanism. And because I do not want this video to imply that nutrition alone is a complete answer to evening anxiety, I want to mention cognitive behavioral therapy for insomnia, CBTI, which is the most robustly evidence-based, non-pharmacological intervention for anxiety-driven sleep problems available. It directly addresses the cognitive patterns, the hyperarousal, the conditioned alertness associated with the bedroom, the catastrophic thinking about sleep, that nutritional interventions do not reach. If your evening anxiety is significantly and persistently disrupting your sleep, ask your doctor for a referral to CBTI. The nutritional interventions I have described can be used alongside it. Let me close with the larger point. The anxious brain at night is not a character flaw. It is not a sign of weakness or excessive sensitivity. It is a neurobiological state, one with specific, identifiable mechanisms and specific, addressable nutritional insufficiencies that contribute to it. Insufficient GABA receptor sensitivity from magnesium deficiency. Inadequate serotonergic regulation of limbic activity from insufficient tryptophan and B6. Elevated nighttime cortisol from a dysregulated HPA axis. Neuroinflammation reducing the efficiency of every calming system the brain has. These are not abstract problems. They are biological realities that respond to biological inputs. And the food you eat in the hours before sleep is one of the most direct biological inputs available to you. 2 passion fruits, eaten consistently an hour before bed, do not make those problems disappear overnight, but they provide the GABAergic support, the magnesium, the tryptophan pathway nutrients, the prebiotic gut support, and the anti-neuroinflammatory protection that those systems need to work better. Over days, over weeks, the neurochemical environment shifts. The mind that could not quiet learns, or rather, relearns, because it always knew how, to find its way to stillness. That is not a small thing. For someone who has spent years lying awake with their thoughts, it is not a small thing at all. If this was useful to you, please subscribe to the channel and share it with someone in your life whose evenings are too full of the wrong kind of thinking. Leave a comment below and tell me, does the nighttime mind that will not quiet sound familiar to you? What does your pre-sleep hour currently look like? I read every comment, and your responses shape what I cover next. I am Dr. Julian Cross. Take care of yourselves tonight, and I will see you in the next one.